All right. Hey, everyone. It's Dia Walker here. And today I'm going to be doing my lesson number 2, which is on the vestibular system. So yesterday we spoke about fitness and I was mentioning sensory fitness. So that is something that is often overlooked, and the most overlooked system that is sensory happens to be the vestibular system. So I put together a presentation and I'm going to get that going right now. I will go ahead and just confirm that everyone can hear me. So if you can write in the chat box that you can hear me, that would be great. And we are streaming on YouTube as well. So I'm going to go ahead and awesome. Thank you. So I'm going to go ahead onto the vestibular system. Here we go. And let me just get on here. All right. So as I said, this is mini training number 2. It's about the vestibular system. I'm DL Walker. I am a physical therapist. I'm licensed in the United States, and I also have degrees in fitness, cardiac rehab, as well as exercise science. And if you want more information on myself and my work, you can find it on fixyouonline.com, which is, as far as I know, the only DIY website or program that empowers individuals to take control of their health and healing so that they can be an active participant in their self-care. So it's like a DIY for your health. On YouTube, which we're streaming on right now, Fix You Online TV, and there's a Facebook group called Fix You Online. So if you like any of those modalities, that's how you can learn more, reach out, etc., etc. So without further ado, we'll get to the vestibular system. Like I said, you can put questions in the chat box and I'll address them at the end. So yesterday, I spoke about sensory fitness, and I realized when I spoke about it that I really needed to speak about fitness of a particular system that is overlooked. It is not misunderstood, but it is the least understood of our senses, and it is called the vestibular system. And the vestibular system begins to atrophy around age 40. What it does is it's a system or sensory system that we have no awareness of. So again, we understand taste, right? We know what that is. We understand hearing because we can understand the auditory system, and when we hear, we hear. We can see things, right? So those are very tangible senses. Touch is another one. But the vestibular system is not something that we are consciously aware of. And that's why when we have decreases in the vestibular system, we're not aware of them. If you lose your sight, you know it. But if you're losing parts or if your vestibular system is atrophying and not working properly, the changes are very subtle and they often go overlooked in the medical community and certainly in the fitness realm. And what it is, it's like the air traffic controller of the sensory system. It tells the senses how to react to stimuli, not what is like taste, smell, sight, but how to react to it, how to position the body in space. Where are we in space? So it's very important for coordinating head and eye movements or hand-eye coordination. It also helps to develop and maintain normal muscle tone. So isn't it interesting that it atrophies around age 40, the same time when our muscles start to atrophy? So is it our muscles or is it our vestibular system? That's an interesting question that I only thought about today when I started doing this research. It is important for balance, equilibrium, and coordination. So I believe I mentioned earlier that I had taught a post-professional continuing education course on balance enhancement and fall prevention. And that is where I started to become interested in the vestibular system and also incorporate the vestibular system into my programs for fitness as well as rehabilitation. It is important for eye control, and that's usually how it's diagnosed. There's a lack of eye control. And interestingly enough, it's really important for attention. So multitasking is a vestibular system activity. So it is actually something that will help develop the vestibular system, as well as something that is necessary for you to be able to multitask. So for example, there is a 100% chance of falling if you are unable to walk and talk at the same time. It's vestibular. So if you are having difficulty with things like that, that is oftentimes a telltale sign of a vestibular atrophy, injury, or disease. So here's the anatomy of it. I'm not going to go into this very much, but it was talked about a little bit yesterday. So here we have the vestibular duct and the cochlear. This is more for hearing, right? And then attached to it are three organs that consist of the vestibular system. The saccular, the utricle, and then there are three semicircular canals, the anterior, lateral, and posterior. And it is the hair-like structures in these semicircular ducts that tell us where the body is in space. And oftentimes when there are crystals in here as well, they are dislodged. They can cause something called benign paroxysmal positional vertigo, which is also known as BPPV. And it is, the symptom of it is dizziness, particularly dizziness while lying down, and either changing a position from lying down to sitting or rolling over in bed. And it is very easy to treat. I think I have a reference in here should this happen to you as well. Now, here's something that I found. This is from the ilslearningcorner.com. It is a school-age kids learning resource. And the vestibular system is really important for kids who have sensory issues. And again, I call it the air traffic controller of the sensory system. They call it an inner GPS. Okay, so it's kind of like telling the body where to go in response to the sensation. So again, the senses tell us what, the vestibular system tells us how. So here's some examples for the visual. It tells the eyes what they are seeing and how the correlation with objects and words. With regard to hearing, it tells the ears what to receive, store, and recall. And again, isn't it interesting that as people get older, they are less able to distinguish sounds that are when you're in a crowded restaurant. And again, is it hearing or is it the vestibular system? Isn't that an interesting question to think about? Hey, you know what? It seems that I'm having difficulty hearing. Maybe what would happen if I trained my vestibular system? And I'll try to look for some research on that because again, it's something that I question. Motor planning tells the body how to respond to motor skills. So it's, when we're going ahead and sports are a great example, or even just the initiation of walking. It's okay, well, it's the vestibular system giving information to my muscles and in the body to go ahead and create a coordinated plan of movement, right? By telling my body where it is in space as well as what's going on with gravity. It recognizes textures and sensory information in the environment. So again, it tells us how to react, not what. Now, proprioception is really important with balance also, and those are sensory organs within the muscles that tell us, again, kind of where we are in space. Proprioception is really important for balance and injury prevention. So again, things that will tax the proprioceptive system are going to be helpful with regard to balance as well as the vestibular system. Again, proprioception is not something that we think about. Then also behavior, attention, and fidgeting. Interesting. So it says here that it helps a child's actions become automatic. So they don't have to think about sitting in their chair, listening to what the teacher's saying, and also regulating emotions. So some vestibular stimulants like rocking have been found to be calming in, for example, children with autism. Also, elderly individual or people with Alzheimer's who are become agitated very easily. So rocking has become very soothing, and also that is a vestibular stimulant. Interestingly enough, also calming a baby, the things that have been done historically, like a rocking or movement or swinging or having a cradle, okay? Those were things that were all developed over time when we had no idea why they worked, but they do. And intuitively, many of these calming types of activities that are done with infants are vestibular stimulants. So really fascinating. And then I mentioned hand-eye coordination, as well as tells the body how to move in space by giving it information. So super important. And again, overlooked in our fitness routines. I don't know of any one fitness program that just focuses on vestibular. There are some activities that will, tax the vestibular system, particularly in advanced rehab that is done with individuals in sports. So I was blessed to take a course a couple of years ago with a PT who was really getting into this kind of thing with regard to his rehab and with regard to performance enhancement and injury prevention. So that was very interesting as well. All right, moving on. Let's see. So here's a general assessment of the vestibular system. How would you know that your vestibular system is lacking? So there's a couple of symptoms. One of them is decreased tolerance to amusement park rides. So I don't know about you guys, but if I've been on a spinning ride over the age of about, 20, I would vomit. So that was one thing. And then also amusement park rides in general. The other thing is that if you're walking next to someone and you find that you veer into or you veer from side to side while you're trying to walk straight, that is often a symptom of it. Difficulty turning your head and walking without veering, right? That is also sometimes also when we're driving or we're on a bicycle, turning the head, the body tends to follow the head and you'll veer. A history of head trauma or also explosions. So things that will injure the inner ear or hearing will often affect the vestibular system as well. So diseases that will do that are often affecting the vestibular system, but again, not as dramatic. When you can't hear, but it might not be as apparent to you with regard to vestibular because it's not obvious. Okay, these things are very subtle. So when you're testing it, what you can do is you can have this can be done in lying down, sitting, or standing. And what you would want to do is that you're going to place your body at a 45-degree angle and then turn the head. And then what you would do is you would go ahead and track your finger. And if you have difficulty doing this, or the eyes will actually do something called nystagmus, which means that they kind of quiver. Because remember I said this is eye control. So if you see somebody whose eyes are moving, usually that's due to a head trauma. Those people will have vestibular dysfunctions. There's an actor called Shia LaBeouf. If you ever watch him on YouTube, you can go ahead and look at him. He has nystagmus, very apparent. And as a matter of fact, I'm fairly certain that he was involved in a pretty serious motor vehicle accident. The other way to test it is to close the eyes and march in place for 30 seconds. I want everybody to do this after they've watched this video and go ahead and reach out to me wherever you can put comments about this video and on any of my my places, and let me know how you found this one, because you want to close your eyes and you want to try to march in place and stay in that position. Okay, so your idea is that you're marching and you're not changing position, that you are marching in place. Now, even I am turning just a little bit to do this for 30 seconds or a minute. will also tell you about your vestibular health. So these are ways of understanding if you have any of these symptoms or have a history of any of these problems. There is certainly probably an atrophy of the vestibular system, meaning that it needs to be trained like anything else, any other part of the body. I had a teacher once that said that the human body is the only machine that gets better with work. And I would say, yes, it has to be appropriate and safe work. So again, if we don't use it, we lose it. And if we're not even aware that we're using it, how are we supposed to train it? And so that's what we get into here. So going back to those tests, again, difficulty or being uncomfortable performing any of those activities like the eye tracking. The nystagmus video demonstration that you can look at is on a website, and hopefully this still exists because this presentation was from about 10 years ago, dizziness-and-balance.com. And it will show you a video of nystagmus, or you could go ahead and look at Shia LaBeouf. And on that website, there is some good information should you have a vestibular disease like BPPV or Meniere's or something else that would be injury to the vestibular system. The positive side when you're turned, right, is the direction that the head is rotated for. So if my body is oriented to the right, my head is turned to the left, I'm testing the left vestibular system. Okay. So that's just a FYI. Again, if you suspect this, you can go ahead and look at these things and certainly bring them up to your doctor and or a neurologist would be better. So factors that might injure the vestibular system. Okay, so again, I mentioned head injury, mentioned explosions. Degeneration is also advanced age. Any viruses affecting the ear. So, you know, even a ear infection can affect the vestibular system. Obviously, minor strokes, so decrease in blood supply. And then here's another one, people who are treated with gentamicin sometimes will have injuries to the vestibular system. Gentamicin was an antibiotic. I'm not sure if it's used so much anymore, probably because of this particular problem. So in the Correcticise for Life membership program, there are activities that stimulate the vestibular system in all positions, because again, you might have more challenging issues when you're doing something standing, in which case you want to start training the vestibular system when you are lying down, and then sitting, and then move to standing in more difficult activities. Now, it's important to note a couple of things about injuries to the vestibular system, because you can have vestibular problems that manifest as vestibular problems anywhere in the body. So it can occur even outside the inner ear. So there was a platform diver who was an Olympic level diver, and she had vertigo, which is probably pretty bad for somebody who does that work. And it wasn't until she went to an osteopath who found a dysfunction in her foot. So if you have a problem with balance in standing, right, but there's no problem in lying down or sitting, then the vestibular problem is going on below the waist. Okay, so that's a way. If you're lying down and you're having these symptoms, then the problem is actually in your head, because there's no other, meaning not figuratively speaking, you know, psychologically, but the physical issue is in the cranium or the vestibular system. So again, it can also be the position, because alignment dictates function, which is one of my favorite sayings. So if the alignment is off in the cranium, it can affect your vestibular system as well. So here's how you stimulate it. Racket sports. So obviously, you know, when we're getting older, something like tennis might be out. However, ping pong has been shown to be really effective with regard to brain health and concentration, attention, memory, multitasking, all of those things. So hand-eye coordination will stimulate the vestibular system. Dancing is another one where orientation in space is challenged. Swinging, so again, many people have swings on their porch, right? Not only is it calming, but it's also good for the vestibular system. Rocking chairs, same kind of thing. These things have been around for generations, and we didn't understand why they were beneficial or why they kind of gained popularity, but intuitively we kind of knew. Multitasking, so actually walking while you're talking on the phone. Do not talk on the phone and drive. Maybe that's another issue, another reason why the vestibular system is it would be an apparent reason, right? Because that is obviously very dangerous when you're operating a vehicle. Also, focusing on a point while moving. So you can either focus on a stationary point while you're moving, or you can make it more difficult by focusing on that point and then moving your head up and down, side to side, diagonally. Or you could even take a moving object like a pen, right? And you can follow it with your eyes as you are walking, or actually walking a straight line. So those are the last two. Now, there are some references that I wanted to share. Obviously, I shared that website, dizziness-and-balance.com. But another book that I thought was great is this one by Scott McCready. This is the first one that's on there. It's called Balance in Search of the Lost Sense. And there's interesting stories in here. He is not a researcher or scientist. He's just a guy who observed his dad falling while hiking, and he decided to research balance. So really interesting references to the vestibular system, research that has been done with it, as well as other components that contribute to balance. And then this one is called The Brain That Changes Itself, and this is by Dr. Norman Deutsch. He wrote another book called The Brain That Heals Itself. Both of them are case studies and really fascinating reads. The first chapter in this particular book talks about a woman whose vestibular system was destroyed, and how by creating a device that stimulated the tongue, there's something called neuroplasticity, which means that another nervous sensory organ can help a different one. And it talks about this device that really changed this woman's life. And in this book, it says that there's a PBS special called The Brain Fitness Program by Dr. Norman Deutsch, which I think would probably be an interesting watch as well. Because again, the vestibular system is not only good for our body, but it's also good for our brain. So with regard to brain health and fitness, particularly when we get older. So again, is it Alzheimer's or is it atrophy of the vestibular system? Is it a loss of hearing or is it atrophy of the vestibular system? So it's really kind of interesting questions to ponder, as well as taking a look at it and doing some of these activities yourself and bearing in mind, hey, listen, yeah, I might have a vestibular deficit, right? But it's not affecting me now. But when you're getting 70 and 80 and 90 years old, falls are one of the primary killers of individuals. And also even fear of falling is a risk factor for falls. So I believe that my next class tomorrow is going to be about balance. And again, 5 p.m. Eastern Standard Time, so tune in for that. And at this point, I'll go ahead and see if there are any questions that I can answer about the vestibular system, if I can find the chat box. So I'll go ahead, I think I have to stop share, and there we go. Any questions on the vestibular system? Nope. Interesting to think about, interesting to research, and certainly something that needs to be addressed sometimes in children with behavioral issues, children with sensory issues, as well as when we get older. So again, something that is oftentimes overlooked in our healthcare system, that is important to be mindful of. So here I am on YouTube, and I'm not seeing any questions there as well. So with that, I will just go ahead and ask you guys to give that test a try, both of them perhaps, the eye tracking as well as the marching in place for 30 seconds, and see where you wind up. And let me know how you fare with that, either in the comments or in future tapings. So with regard to this, go ahead, and if you like it, go ahead, give it a like, give it a share. Share the Zoom meeting information and registration to anybody that you think might have an interest in it, particularly since we're going to be doing balance tomorrow. If you know of anybody who might have some interest in learning more about balance, then go ahead and give them this information to share. And certainly go ahead and reach out if you have any questions. So have a great night, everybody, and I will see you tomorrow. Ciao.